Hi, good afternoon, everyone. My name is Olivia Hensey from the New England QIN-QIO, and I will be moderating today's webinar. Thank you for joining us for today's webinar on Let's Recommit, Staying Healthy and Keeping Resolutions for the Year Ahead. Before we get started, I'm going to quickly review a few housekeeping items. This call will be recorded for training purposes. I'll provide you with details on accessing the recording at the end of this webinar. The phone lines will be on mute for the duration of the presentation. And we will take questions at the end, and I will provide you instructions on how to unmute your line. At this time, I'd like to introduce today's speaker, Kathy Roby. Kathy is the Connecticut Home Health Lead for the New England Quality Innovation Network Quality Improvement Organization. Kathy is a registered nurse with over 40 years of experience in home health care. She specializes in quality management, improving home health provider clinical outcomes, and reducing acute care hospitalizations for Connecticut home care providers. Please welcome Kathy Roby.
Thank you, Olivia. Even though you did tell everybody how really old I am, it's okay. So, it's February, and our topic today is staying heart healthy because it is, after all, National Heart Health Month, and keeping our resolutions for the year ahead. It's February. Today is the 10th. How are your New Year's resolutions doing? Did you break them all? Are they hanging in there? Did you keep at least one? Let's today take this opportunity, and we're going to recommit. We're going to pretend that whatever we fell off the wagon for, we didn't. And we're going to start fresh. We can do that, not just with our resolutions, but we can also do that with our commitment to this project, to the New England Home Health Collaborative. This is, as I said, every month, this is a project that we do together. Those of us at Qualidigm, working with home care providers in Connecticut, New Hampshire, and Vermont, and our partners at Health-Centric Advisors, working with their agencies in Massachusetts, Maine, and Rhode Island. We hope that you'll look at all of the webinars that we've done. I can't believe it. It's already been 13 months that we've been doing this. They're all on the website, healthcarefornewengland.org. They're recorded. They're available to you so that you can use them for staff training, as a refresher, to do most anything that you need to with them. This is what the website looks like. And you can see, slightly left of center there, a tab called For Providers. And it's under this tab that you will find Home Health. When you get to that section, you can proceed through it, and you will find all the webinars as well as exciting announcements about other events that are coming. Our objective today is to, first of all, as I said, we're going to renew and revitalize our commitment to the Cardiovascular Health Initiative. We're going to try and renew our understanding of the objectives and goals of this project. And together, I hope that the 100-plus agencies across the 6 New England states, together we are going to complete and achieve Milestones 1, 2, and 3 of the Cardiovascular Initiative. And hopefully, once we all get to Milestone 3, 12 months from today, we will be celebrating agencies that have made a full year and completed it all the way to Milestones 4 and 5. To get Milestones 1, 2, and 3 completed, if you remember from previous programs, you need to get registered on the site, register in the site for your data collection, and download the appropriate best practice package depending on what measures you've chosen to work on. Our final objective for today is to celebrate American Heart Month in your agency by participating in the Million Hearts campaign. And I am hoping that at some point in the course of this month, you will have on a bright red sweater, a bright red blouse, a bright red dress, so that you can support everyone who's ever had a cardiac-related event. and help us all to live long and healthy lives. So, home health quality improvement. What is this and why am I doing this again? I've got all those charts to review. I've got adverse events coming out of my ears. I've got a surveyor coming at any moment. I'm really not sure I have the time or the energy to do this. And you're asking me to recommit? Home health quality improvement provides you resources for staff and patient education, something you're required to do anyway. But wouldn't it be nice to be able to push a button and download a program that's appropriate and relevant, that has materials that were designed for each discipline separately, so that you can teach how to work with the congestive failure patient, how to work with the COPD patient. And you can download materials that are designed specifically for your nurse, others for the therapist, others for the home health aide, and still more that are specific to the social worker. That's what HHQI can do for you. It is also going to provide you with data abstraction and reporting. You'll answer one or two simple questions, put that into the system, and you will get tracked and trended reports based on the OASIS data that you're already collecting and submitting. So why are you doing this? Because by tracking and trending this information, downloading the resources, and working hard with your staff to improve their understanding and their ability to work directly with their patients, you will in turn improve your outcomes, reduce hospitalizations and emergent care, and you'll improve the patient experience of care. And where have we heard those before? Improving outcomes, reducing emergent care events, improving the patient's experience. Seems to me, if we do those, every one of us could be a 5-star agency. So if I've convinced you that you really do want to take another walk through the Home Health Quality Improvement HHQI website, let's take a look. We have given you in the past the actual link so that you can get there. When you put that in, the Home Health Quality site, you're going to come to this landing page. And when you do, you're going to click on the tab that says Cardiovascular Health. That will allow you to register for the campaign. When you do, you're going to find that you now have access to these 6 different areas of the site. The cardio milestones are all laid out for you. The Cardio LAN, a learning and action network, is going to give you access to your peers, your partners in this project in all 50 states. You can learn from other home care providers, agencies that are the same size, the same configuration, in areas that could be thousands of miles away, but they may resemble your caseload in terms of urban, suburban, rural. You'll find that you have partners out there that are facing the same problems you are. And together, you can implement those best practices that you'll find on the website. The data registry is there, and there's a webinar that will walk you through, step by step by step, how to get registered in the data registry, how to download information, how to share with others your experiences, and how to learn from others. And lastly, there will be a direct link to the Million Hearts campaign, where together we hope that we're going to prevent over 1 million heart-related incidents of complications this year. So here are those milestones. And what are they? As I said, your very first is just to join the LAN. So many providers have been joining us each month. Last month we had over 60 people signed up for this program. That's a lot, giving up an hour of our busy workday. And everybody came away with something. So I hope that you'll go ahead, get on the website, join the cardiovascular network, and you will have completed Milestone 1 just by signing on. Once you're on there and you have a password and access to everything that's there, you'll be able to find the tab that has all those best practice intervention packages, those BPIPs. We do love our acronyms in this business, don't we? But they are very helpful. Please don't be put off. When you download them and you look and it says it's downloading 96 pages, please don't be put off by that. What they've done each time is to take the material, and as I said, they've customized it discipline by discipline. As the quality manager, as the champion for this program, you will want to try to be familiar with all of it. But you don't have to do it all at once. Just try to get comfortable with at least the nursing part, and you'll be able to work with the other disciplines over time. You're going to click on the data bar on the blue toolbar at the top of the screen, and it will give you the ability to register to get into your data. Once you are registered, you can select a measure, and we will talk about those. You'll select a measure, you'll work with your staff, and then at the end of a month, you can enter the information you've gathered. Remember, I promised you, it's 1 or 2 simple questions for whichever one of the measures you selected. There are only 5 of them, and you do not have to take all 5. You can take one, any one, and it will be just fine. Once you have entered a month's worth of data and downloaded your first report, you can celebrate. You've completed Milestone 3. 6 months from now, in August, you can celebrate Labor Day weekend with Milestone 4, having closed a total of 6 months of data. Isn't that a wonderful thing? And I promise you, it's a very simple, easy task, at least the data collection part, and getting through these milestones can be done. If you find as you're starting that you need help, at the end of our presentation today, there's contact information for the home health lead in your state. Please reach out to us. Send us an email. Drop us a line. Give us a call. We will personally walk you through. By phone, by conference call, or in person, we will walk you through. So here is your page where you're going to join the Cardio LAN. This is where you will register. You can see the milestones are down the left-hand side. And where the Learning in Action Network button is, that nice big round blue button on the right side, if you click there, it's going to take you right to the registration page. If you click on the best practices on the left-hand side, you will get a list. And you can see on this slide, the very first one from December 1st of 2014. We are calling the BPIPs, or HHQIs, the ABCs: aspirin, blood pressure control, cholesterol management, and smoking cessation. There's really wonderful information, teaching materials, handouts, anything that you could possibly need or want. Even posters and free things that you can order. The data registry is on the next slide. If you had clicked on that button, the fourth one down on the left side, you would have come to this screen. The square box on the right-hand side says, click here to register for your data access so that you can begin to collect information and put it into the data registry. Those who are actively participating, collecting and submitting patient data, indicate that this rarely, if ever, takes more than 2 hours a month. That's all, 2 hours in a month. And that's agencies that have chosen to collect large amounts of data. But an adequate report, the more data, the better. However, if all you have done is enter 10 or 12 cases, it's plenty. You'll at least be able to track and trend and tell whether or not you are actually doing better in the outcome you selected. When you go to register to get your data account, you click on that box. This is the screen that you're going to get. First of all, you will need to select the top box that says, yes, I'm willing to be my agency's account administrator. As you move down on the page, there are step-by-step instructions for how you are going to actually complete your registration. I have to verify because this information is highly confidential and specific to your agency. They need to verify that you are who you say you are. So you're going to need your CASPER report. From OASIS C, you need process measures 2-bar report. Notice the begin and end dates that they've given you. When you find the file, you're going to go to the measure that says prevention pneumococcal vaccine ever received. On that page, in that question, you're going to find an eligible cases number. That is the number you're going to put in that box where it says eligible cases. Once you've done that, it will match that to the agency's CMS provider number that you've given it when you registered, and then you click on the verify button. If they match, you will then be in the system and you'll be all set to go. You'll get this message on the bottom that says, you have been verified. You may need to log out and log back in. Once you've done that, click on the home, click on that blue verbiage, and you'll be able to continue. This is where it will bring you. Your account has now been approved. You can click on the links to download your files. So here, you're going to enter your CCN, that's your provider number. Then you're going to see below that the drop-down, Home Health Cardiovascular Data Registry. You're going to click on Get Reports, and you'll begin to get access to your agency's information. Once you've started, you're going to see on here your facility, the name of your agency, the person who's been selected to be the account rep. It will give you a message that says your account is approved, and then you can download the reports once you've selected which ones you want. Someone needs to put their mute button on, please. Thank you. This is the base page of the cardiovascular data collection. You can see it gives you the year and the month that the patient was discharged in. When you click on the abstract button, this is going to give you a list of patients. You then need to select the measure. What are you reviewing for the month of July? Let's say, obviously, remember, you don't have to select 4 measures like they did here. You could decide you're going to only monitor aspirin use. You would click on that. You're going to then save your setting. You're not going to change it for the rest of the month, okay? Save the setting and move on. Here you have the data that they've been collecting for you. Every time that you completed a discharge OASIS in the month of July, you selected the aspirin measure. On the bottom of the tool for collecting data, or on the website, the HHQI website, the section that tells you all about collecting data regarding the use of aspirin for anticoagulation, there's a list of diagnoses that this question applies to. Many agencies, when this project first began, panicked, thinking, I'm not going through all those charts to find the ones with that diagnosis, to find the answer to the question, but you don't need to do that. You clicked on the previous screen on aspirin usage. Once you've done that, the system has already gone through your discharge OASIS records, selected those that had a relevant diagnosis, and now all you need to do is to, on that line where it says edit, if this were a live database for your agency, you would have your provider number, the patient's ID number, the start of care date, and the discharge date. You would click on the edit line, and you'd be able to now enter data for that particular patient. Here's the information. You clicked on the edit button. You'd be able to change anything you needed to if there was information that was incorrect. They do need to know if the patient that you're reviewing is both Medicare and Medicaid. So you're simply going to answer yes or no. Here's the aspirin question. This is the only question. If you're only working on patients on anticoagulation therapy, this is the only piece of information you need to answer. Was this patient on aspirin or any other antithrombotic agent during this episode of care? Yes, they were. No, they weren't. Or there was a contraindication in the record. If you were following blood pressure, you would be looking at this one. They have, however, removed the follow-up plan question because it was too variable and the data was not validating. So they do have questions for each of the different measures. You have the cholesterol question here. This is the second. There are two measures relating to cholesterol. This one is more difficult for agencies to work with, and that's because in order to do this measure, you really have to be able to get access to the information, the actual cholesterol results, and that's much more difficult for agencies to do. They are looking for the LDL level and the date that it was done, and that is hard for agencies to collect. Any agency that has selected this measure and is collecting this data, I give you the marks, because that definitely is a challenge. Tobacco use, smoking cessation does have 3 questions, but it's just this. This is all that you need to know. So if you registered for the LAN, you downloaded a BPIP because you selected anticoagulation therapy, so you downloaded the BPIP on that, and you registered for the data registry and put in your first month's data. You are all the way to milestone 3, and it's definitely time for you to step out and get yourself a Valentine candy. Okay, tell me, why am I doing this again? Why am I putting myself and my agency through this? Remember, the measures that the LAN is working on will improve the health of your patients with heart disease, COPD, and diabetes. If you improve in these measures, your process and outcome measures are going to improve. By focusing on these, you are going to improve your hospitalization and emergent care, and the increased education, the increased concentration on working on it together with your staff will ultimately improve the patient experience of care. By focusing in this way, why am I doing this? I'm doing this because I want to have better measure outcomes. I want to reduce my acute care hospitalization and emergent rates, and I want my patients to have the best possible experience of care. Because if I do that, the net result will be a 5-star agency. Okay, so I talked you into it, right? And you're sitting there going, okay, fine, I'll try. But how exactly am I going to do it? By selecting one of the measures on the next slide. Just one. That's all I ask. Download the best practice plan that relates to that measure. Take it home over the weekend. There's really not going to be anything good. The Super Bowl is done. There's probably not a decent movie in sight. Read it. If nothing else, you'll get a good nap. Review the measure information and the education materials with your clinical managers. Make a plan. Pick out just one small portion from that particular best practice package and educate your staff across all disciplines. Talk to them about what is this project and why is it so important to your agency. Because you want your agency to be the best that it can be. You want your agency's patients to have the best care that they possibly can. I know that you do. And so if you resolve to take part in this project, put up the posters, post the information, make a trending chart, put it right up on the wall so that all of the staff can see how you're doing in the measure that you selected. You'll increase the participation and increase the motivation. There is a data abstraction tool, a single page, one for each of those measures that we looked at, and that tool has just that one question. So if you selected aspirin, you're going to have a single page that has just that one question on it. You can now distribute copies of that to your nurses and just say to them, all I want you to do is when you do the discharge oasis, remember that we're focusing on anticoagulation therapy and educating our patients. Just answer the question. Did your patient, yes or no, take aspirin, Plavix, any one of these medications anytime while they were on our care? Just answer yes or no, put the patient's name on it, drop it in the box. Now you've got all the data you need. When you go to the website to enter the data for that particular month, you have all the data abstraction tools. You go down that list, pick the 10, 12 records you want, pull those out of the box of files that you got, of the single pages you got back from your staff, enter the yes or no answer, and you're done. And that's all you needed to do. Implement the project, educate your staff, distribute the question, collect the completed tools, and keep reinforcing it. You have to be patient, but be persistent. It does take at least 3 months, and sometimes up to 6, to begin to move the needle on the measures that you're working on, but it will happen. There are detailed user guides on how you can interpret and understand the reports that are in the website. I do want to tell you that there are a multitude of other reports on this website besides the specific Cardiovascular Data Registry report. HHQI has phenomenal reports that will tell you a great deal about your hospitalization rates. It's going to look at what day of the week did it happen. What was the reason for the emergent care event? It's going to look at month by month. Is there a trend? Were the runs to the hospital, the emergent care trips, did they peak very high in the month of March? Did they come down over the summer, peak again in October or November? These are interesting trends. Looking at the day of the week will tell you a great deal. If you're finding that these are happening on Saturday, Sunday, and Monday, odds are you have patients that really needed a visit over the weekend, but instead made a phone call, talked to somebody on call, and were sent off to the ER, when a home visit might have prevented it. So these are very interesting reports. If you bring them up and you're not sure what they're telling you, again, go to the contact list at the end of this presentation. Call your home health lead for your state, and we will go through these reports with you. We will help you to understand what it's telling you. So you want to keep looking at these each month. We have, in other presentations, gone through the reports themselves. You'll find those on the QIN-QIO website. There's a very detailed presentation on the data abstraction and data entry, and a very detailed presentation on how to specifically Use PDSA to improve your cardiac-related outcomes. If you need more help, we are absolutely very happy to set up an agency-specific on-site visit, webinar, or conference call. Here at Qualidigm, I'm delighted to invite small groups of agencies in to come together. They can share what's working or not working, or I'll come out one-on-one to meet with you. This is not a problem. We're here to work with you, and we want to hear from you. So here's our contact list. I'm here in Connecticut. Doreen is there in Maine. Georgette in New Hampshire. Brenda in Rhode Island. Jill in Vermont. Karen, Pat, Barbara, and Chris, all in Massachusetts. Those are our email addresses. Once you locate us, drop us an email. When we respond, our contact phone numbers are on the bottom. Don't hesitate. We need to hear from you. Early on, I mentioned the Million Hearts Initiative. This is the last piece of this project that I want to talk about this afternoon. Million Hearts relates to the home health quality improvement measures very closely. Home health providers, home health staff, we are easily 85% women still today. Sure, there are lots more male nurses and male therapists than there used to be. Lots more male staff managers in the home health industry. Still, this is a heavily female-dominated profession and line of business we are in. And it's an unavoidable fact that 1 in 3 women will die of an avoidable cardiac event. We know, as nurses, we know, if we dropped blood pressure, we'd reduce the incidence of heart disease. We know that if we had better diets, we'd reduce our cholesterol and reduce heart disease. And we know that if we never started smoking when we were in nursing school, which I will admit is my short-lived love affair with the weed, if we stopped smoking, we definitely would stay out of the hospital. The Million Hearts Initiative was set up so that we could aggressively attack these 4 issues. We need to work on healthy diets, healthy lifestyles, heart health education, not just with our patients, but with one another. What kind of home health, community health providers would we be if we didn't set a better example than we already do? It's American Heart Month. Do you have a little red dress pin on your lapel? I do. I actually should have 2 of them. I've earned them. I didn't follow those principles at the beginning. I had 2 heart attacks. And it's a true statement. Women don't have heart attacks the same way. And no, even though I'm a nurse and not that bad a one, I didn't know. What can you do to commit to improving heart health in your agency so that your agency and your staff can set the best possible example? Make a commitment. We said we were renewing our commitment, renewing our New Year's resolutions. Commit your agency and your staff to promoting heart health and supporting American Heart Month. Start a noontime walkers club. Fast blood pressure checks once a month. Swap out your vending machine for a healthy snacks machine. They have those now. I couldn't believe it. I saw an article in the paper about a franchise where you can sell healthy snacks vending machines. Share recipes for healthy eating. Put poster boards up all over your office to share this theme and support it. Once you've started in your office, you'll be able to carry the word out to your patients. Engage them in the conversation. Use friendly terms. Talk about healthy eating. Banish the word low-salt diet. Banish the word diet restriction. It's not a restriction. I'm going to eat anything I want that's on this list. Draw the link between heart health is heart happy at home, not heart sick in the hospital. Use patient engagement, patient self-management techniques so that your patients and your staff will be motivated because they will know that this is something they own. It's theirs. It's not yours. It's theirs. And because it's theirs, they are going to take control. They're going to eat better than they had before. They're going to smoke less, if not at all, and they're going to take control. So support the program. Go to the Million Hearts website, log in, click on the pledge. Take the pledge that says, I support the Million Hearts campaign. Did you wear red last Friday? Most of us were busy wearing snow all over us everywhere. If you missed it last Friday, there are still 3 more Fridays. Wear red every Friday this month to support this campaign. Gather together just once in this month. You still have, 18, 19 days? Have a heart-healthy lunchtime together. Follow it up with a 10-minute walk in your office. You can do it. I visited an agency about 3 weeks ago to reorient a new champion for this program, and they were just starting that very day to do their first heart-healthy walk in their office. It was raining, it was cold, it was miserable. Nobody left the building. Everybody gathered at the reception desk, and they walked, not vigorously, not fast, not arms pumping. They walked leisurely, calmly, so that everybody could still have a conversation. And they walked around for 10 minutes, and then they went back to their desks, feeling better, fresh bit of oxygen in their brains, a little more relaxed, a little more mellow. 10 minutes. That is committing your campaign, your office staff, your whole staff to being heart healthy. You can do it. To set an example, we have our own in-house champion. Marissa, are you there?
Yes, Kathy, I'm here.
Hey, Marissa is our heart healthy champion here at Qualityne. I'm going to give Marissa the floor for a couple of minutes, and she's going to share with you what we're doing so that we're all going to be much heart healthier at Qualityne.
Thank you.
Take it away.
Thank you. Yeah, we're doing several things. We've swapped out our vending machine, and we offer a couple of healthy snacks for staff. We also started a stair climbing group since it's still winter, but we thought we would get people started by climbing several of the stairs every day. So a group of us meets and climbs the stairs for 15 minutes. And today we actually had a couple of recipes for staff. We had a tomato drink this morning, and then we had a nice light caprese salad with tomatoes and mozzarella to just showcase the red tomatoes and how good they are for you. And we also share healthy recipes by email, and we send out short workouts of the week so that you can do a 10-minute video to get yourself going in the morning. And it's been very, very good. People are really responding well and doing a lot more activity.
Very good. Thank you, Marissa. And there was lots of red in the office when I was leaving there today. Lots of people in red blouses and red sweaters. Thank you very much. I appreciate your sharing. So if you're still with us on the call, I hope that you will also, when we unmute the line, that you'll share what you're doing. And if you haven't started yet, please feel free to unmute your line and ask about it. Talk to Marissa if she's still there. Talk to us. And think about how you, too, can celebrate Heart Healthy February in your office. Olivia, I'm going to turn it over to you. We can unmute the lines and see if we have any questions from anyone.
All right, wonderful. Thank you. Thanks for a great discussion. At this time, we'll take a few questions. If you'd like to ask a question, please press #6 on your phone to unmute your line, or you can put a question in the chat box. So please feel free. Remember, it's #6 on your phone to unmute your line.
Well, we must all be bashful today, or they're all tired out from shoveling. No takers, then we must be done for today. I do want to give everybody a heads up. 2 of our Home Health Leads team members, Georgette and Doreen, are working very hard to put together a panel presentation for next month in March on the 10th, I believe, our usual second Wednesday of the month. We will be doing a panel presentation. We have invited 3 agencies that are currently participating, working on a measure, collecting data, and they're going to share with you the process they went through, how they selected their measure, the different steps they've taken to implement change, and hopefully you'll join us. If you have questions you'd like to ask them, if you're not comfortable doing it out loud on the line, please email them to your contact person for your state, and we will put those questions to the panel. We are hoping that this will give us the opportunity to kickstart a little bit of peer sharing and peer mentoring so that anyone who's been on these calls, who hasn't started yet, if you are concerned about it, a little nervous, not sure how to get going, please join us next month. We're going to talk about how to get started. We're going to let you talk to your peers and hear from these agencies, how they chose their measure, how they downloaded the information, how they're using it, and what they're doing on a daily basis to make this work. So please join us on March 10th, and if you do have any other questions that come up after today's call about getting on the site, getting your measures selected, and doing this project, please reach out. All of us are here from all 6 states. We're anxious to hear from you and anxious to work with you. Have a really great day. Be safe. Wear red. Go for a walk. Have a good time, everyone.
Thanks, Kathy. Thank you all for the great discussion. I just have a few last-minute announcements before we end the call today. When you close out of this webinar, the evaluation will automatically pop up on your computer. If you could please fill that out, we would greatly appreciate it. If you don't have time to fill out the evaluation right now, or you're currently sharing your computer with someone else, you'll receive an email tomorrow morning with the link to the evaluation as well as the link to the event page on our website. The PowerPoint presentation is already posted on our website, and within the next few business days, a recording and a transcript will also be added. And be on the lookout for emails about our next webinar in March. And thank you again for attending, and I hope you all have a wonderful day.
Thank you.
Thank you. Thanks, Kathy.